Are you on thyroid meds but still super tired? This is a really common issue, and there are 11 overlooked reasons why that might be. Hi, I'm Dr. Izabella Wentz, your thyroid pharmacist. I am a Hashimoto's expert by ways of being a Hashimoto's patient and a human guinea pig. I was able to get my Hashimoto's into remission through functional medicine and the root cause approach. And on my Hashimoto's journey, fatigue was probably the most impactful and debilitating symptom that I had experienced. I was somebody that would sleep for 11 to 12 hours a night and still wake up super, super tired every morning. This was definitely not the life that I wanted to lead as a 20-year-old. I just really couldn't do anything that I wanted with my life. I had all of these ideas, but I had absolutely no energy for anything other than coming home and sitting on my couch. So, I want to share some of these overlooked strategies that can absolutely reverse your thyroid fatigue and give you energy, sometimes in as little as 3 days. So, in fact, actually, we're going to be focusing on this very topic in the Thyroid Pharmacist Healing Conversations podcast this entire month. And I'm going to give you a quick breakdown of all of them. Some of them you can start trialing on your own. Some of them you might need a practitioner to guide you. Some of them may require a little bit of further testing, but I want to just give you all of the information so that you can take back your energy and live the life that you're meant to live. The first thing, this is kind of an obvious one, but if you're on thyroid meds, you want to make sure that you're on the right dose of thyroid meds. Now, some doctors will start a patient on a thyroid medication and they won't ever really check the TSH again. Or they might check the TSH, but they might tell you that it is optimized or just fine, when really you might have the perfect TSH for a sloth, not for a human being that wants to get things done. So I'll give you an example. I've had various lab tests where my TSH was at 4.5, at 8, and my doctors were saying that this is normal thyroid function. You do not need to do anything. That's not correct. Most people with hypothyroidism who are on thyroid hormone replacement do feel best with their TSH somewhere between zero point 0.5 and 2. Now, I will say that might be a little bit lower for some people and a little bit higher for others. That said, most people do feel best within that range. And I will argue that some people will actually feel best when their TSH is right around 1. In fact, women of childbearing age without any thyroid dysfunction, their TSH should be somewhere around 1. So if you haven't had your TSH tested for a while and you're on thyroid meds, I would highly encourage you to do so. Get that number tested, and you might need to increase your thyroid hormone medication to get to that optimal TSH level. The second reason is also related to thyroid medications. Sometimes people might be placed on a medication like Synthroid or levothyroxine, which is a T4 containing medication. T4 is one of the active thyroid hormones, but it's not the most active thyroid hormone. In fact, T3 is the active thyroid hormone that really helps us make our hair beautiful, gives us energy, helps to generate heat, helps with our metabolism, helps with pretty much most of those thyroid symptoms. And a lot of times people will be put on levothyroxine for the reason that doctors oftentimes think that levothyroxine should get converted into the more active T3 in the body as the body needs that. Of course, I can say as a pharmacologist, this is known as a prodrug effect, where a medication gets converted into the body to the more active medication. Now, as a pharmacologist and a thyroid patient, I can also tell you that this happens perfectly well every single time on paper. Doesn't always happen so in the body. And so we can end up with a lot of people who are on medication like levothyroxine or Synthroid, but their body just doesn't complete enough of that conversion to the active T3. And so they end up with a lot of symptoms. One of the simplest ways to overcome this is by getting on a T3 containing medication. So, this might look like an add on of a medication like Cytomel or liothyronine by your doctor, or switching to a medication that's a natural desiccated thyroid. For example, Armor is one brand, or switching to a medication that is compounded that contains both T4 and T3. Now, I know that these medications aren't available for everybody, they're not appropriate for everybody. And there's also reasons why a person may not convert T4 to T3 that I oftentimes recommend looking into. One of them might be a lot of stress. Another one might be you're fasting too much. Another one might be you have low levels of ferritin, which is the iron storage protein. Another one might be that you have low levels of zinc. And so there are actually things you can do to undertake your T4 to T3 conversion to support your body's way of doing so. One of them is also going to be liver support. I'll share a little bit more about that as we go through this list. Now, I want to do a deep dive video into this on the podcast as well on YouTube. So be sure to subscribe to get my video on the how to make your own T3 without necessarily needing to rely on a prescription. The next reason why people might have issues with fatigue despite being on thyroid meds is actually due to anemia. Now, people typically think of anemia as an iron deficiency, and this is partially correct, but you can also have an anemia of B12 and of folate. And a lot of times I see people might need to have all three of these replaced in order to feel their best and have really good energy levels. And the standard tests for anemia might actually miss iron deficiency anemia. The test that I like to utilize for iron deficiency anemia is known as ferritin. And we need the levels to be between 90 and 110 for optimal thyroid function. And a lot of times I'll see women that are on levothyroxine and their ferritin levels are very low and they're still having thyroid symptoms. And one of the things they can do is optimize their ferritin levels, and then they end up having normalized thyroid function. This is because our iron can carry and help our cells utilize thyroid hormone properly. A lot of times women will say when they have low ferritin, they might have breathlessness, they might have fatigue, they might have pale skin, they might have hair loss. Some of them can have emotional instability, some of them can have insomnia. I know this is actually a symptom of mine is I'll get insomnia if I have low ferritin levels, and some of them will have restless leg syndrome. So if you've got any of those, I highly recommend that you get your ferritin tested. I also recommend testing for B12 levels. Now, this one is tricky as well because a lot of the standard lab tests will give you a reference range they'll call normal, but again, it's like is this normal for a person that's bedridden and exhausted, right? Versus what's the normal for a person that's thriving. And so for my B12 levels, I really recommend aiming above 700. And oftentimes people do need either an injection or a sublingual version of B12 because some people may not absorb it orally. And so you might be taking a multivitamin that already has B12 in it, but that multivitamin just might not be really doing anything for you. The other thing to consider would be making sure that you are properly folate supported. Many times people do benefit from the methylfolate version of folate, which is the active version, especially if they have the MTHFR gene mutation. This is something that's very helpful to test for. I oftentimes recommend people with Hashimoto's do test for that. The fourth reason why people might have issues with fatigue could be food sensitivities. Now, I know this sounds a little bit wild and far stretched, but some of the common ones I see that can make people tired are going to be gluten and dairy, as well as soy, corn, and eggs. Now, I will tell you, when I did outcome surveys with my clients and with some of my readers about what really helped their fatigue, in some cases, they were reporting that the gluten-free diet was more helpful than actually thyroid medications. And so this is a really, really important consideration. I would consider doing an elimination diet or food sensitivity testing. And I'm going to link in the show notes to my favorite one by All Test Lab. to figure out if you have a food sensitivity. Another reason why you might be struggling with fatigue is blood sugar issues. So, if you have blood sugar crashes, they can actually make you feel tired, right? If you notice that you're super tired, like let's say after lunch, that can be an indication that the lunch that you had perhaps had not enough protein or not enough fat or too many carbs for your system. And that sent you on a blood sugar crash. Generally speaking, if you feel hangry, shaky, anxious between meals, this can be a red flag that you have too much blood sugar swings. My general recommendations for that start with balancing your food intake with more protein, more fat, more fiber, generally reducing starchy, sugary carbs. And you're going to find that your energy levels and your mood really, really stabilize. This is super important for that 3 p.m. crash. Supporting your digestion. Not many people realize this, but people with hypothyroidism and Hashimoto's oftentimes have low stomach acid. So, what does that mean when you have low stomach acid? That means that your body needs to expand a ton of energy to digest your food and to extract nutrients from your food. In fact, it's going to do a poor job at extracting nutrients from your food. One of the things we can do for this is support our stomach acid. You can do this with putting a teaspoon of apple cider vinegar in a glass of water and drinking that with your protein containing meals. You can do this with taking a teaspoon of squeezed lemon juice and sipping that with your meals. You can also utilize supplements. I really like betaine with pepsin for protein digestion. I have to tell you, this was a really big game changer on my healing journey. So I went from sleeping like 12 hours a night to waking up after 7, bright eyed and bushy tailed, once I started utilizing betaine with pepsin. Now, there is a trick to utilizing it correctly. So, generally speaking, you would take 1 capsule with a protein containing meal. If you didn't feel anything, you would go up to 2 capsules and so on and so forth. If you felt some burning or discomfort in your throat, that would mean that you took 1 capsule too many. So if you felt this at 1 capsule, that would mean you probably don't need this supplement. If you felt this at 4 capsules, that would mean that your magic dose is going to be 3 capsules per protein containing meal. And generally speaking, if you're eating a smaller protein meal or a giant protein meal, you might want to adjust your dosage. But this has been such a big game changer for many people with that post digestion fatigue. Another common overlooked factor of fatigue is actually going to be sunshine deficiency. Sometimes this is correlated to vitamin D levels, but I would say if you can step out into the daylight first thing in the morning and get some sunshine into your eyes, that's going to be really, really helpful for letting your body know that it's time to be awake, be bright eyed, and be bushy tailed and have lots of good energy. And also, part of that is going to be focused on making sure that you are not exposed to bright lights after dark. This really trains our body to be aligned with the circadian rhythm. I know there are a lot of people that will say, I have no energy in the morning, and come the evening, I get my second wind. And oftentimes, this is going to be a sunlight, sunshine deficiency because when we're indoors, our brain and our eyes are just not getting the message of whether we should be awake, whether we should be lounging in our caves, or whether we should be sleeping for the rest of the night. And so this is a really big free thing that you can do. Some people can also have vitamin D deficiency, which can correlate from not spending enough time outdoors. And this can also be caused by various malabsorption issues. If you do have vitamin D deficiency, you may want to consider a vitamin D supplement or taking a beach vacation, right? Beach vacations are always my favorite. But generally speaking, I like to keep vitamin D levels between 60 and 80. You can get a blood test for this. Again, I wanted to mention I talked a lot about blood tests. You can get these through your doctor. If you don't have a doctor that can order these for you, there's a lab called Alta Labs that allows patients to self-order, and the the tests are already significantly discounted. They have labs in every state and every city, and in some cases you can actually submit the lab test that you paid for on insurance and get reimbursed. One other thing I'll mention is if you live somewhere like Chicago or Amsterdam or one of these places where it's just not a lot of sunshine throughout the day, you might also wish to consider a light therapy box. Sometimes they're called seasonal effective lamps, and these can be a really, really big game changer for boosting your energy first thing in the morning. One thing you may want to consider is, let's say, if your morning routine is to wake up and go to the bathroom and brush your teeth, right, and put on your makeup or do your hair, you can just have that light therapy box in the bathroom with you. You don't have to like directly stare at it. As long as it's there and illuminating your space, you're going to get those benefits. You do want to start low and go slow. Sometimes the lights can be a bit overstimulating, but generally speaking, anywhere from 5 minutes to 30 minutes first thing in the morning can really restore your energy levels, especially if you have that seasonal affective disorder. I mentioned that thyroid hormone conversion issues can lead to poor energy issues when you're already on thyroid hormones. Now, one of the ways to support your thyroid conversion is to support your liver. The amazing thing is, a majority of that T4 to T3 conversion happens in the liver. And so, utilizing liver supportive nutrients such as N-acetylcysteine or herbs like milk thistle or using cruciferous vegetables, this could be really, really helpful for converting your T4 to T3 efficiently. I accidentally came up with a liver reset protocol for some of my clients where they weren't getting better with anything. And one of the things they noticed is by following my liver reset protocol that's in my book, Hashimoto's Protocol, within 2 weeks, they were able to shift their symptoms, including that fatigue. Another thing that I discovered that can be a really, really big game changer for fatigue is actually one very simple, inexpensive nutrient, but you have to mega dose it. So the nutrient is thiamine or B1. This is something that I came across a very small case study of only three thyroid patients, and they were each given 600 milligrams of thiamine. And within 3 to 5 days, their fatigue completely transformed. Now, I did a SpectraCell test many, many years ago on my healing journey. And I found that I had low levels of thiamine, which I was surprised about because when I went to pharmacy school, and if you have any medical training, you'll know that thiamine deficiency is typically correlated with like alcoholism, which I didn't have. Like, I don't think I had had even a glass of wine for many years at the point where I did this test. However, various things like irritable bowel syndrome, genetics, drinking tea can actually impair your absorption of thiamine. And while alcoholism can cause like very extreme versions of thiamine deficiency, these subclinical deficiencies can also make us have a lot of symptoms. Now, some of the red flag symptoms are going to be this like debilitating fatigue, but also low blood pressure. So if you're somebody that your doctor is always like, your blood pressure is amazing, it's 90 or 50, or maybe if you have an integrative or functional doctor that says, why is your blood pressure so low? This can be a red flag that you're deficient in it. Now, personally, I was always somebody that had low blood pressure. And so I was really, really surprised because I started to take thiamine and my energy levels recovered in 3 days. And all of a sudden, my blood pressure normalized. Now, I will say I took this for a long time. And then during pregnancy, I had to increase my dosage. Sometimes the dosage may need to be increased with weight. And then I've been on and off of it for various years, but this is actually one of the supplements that I still do take because it does make such a big difference for me. in terms of my energy levels, brain function, and that blood pressure. If I go off of it for a while, I'll notice that my blood pressure starts to creep down. The other thing that it helps with too is actually supporting stomach acid. So I discovered betaine with pepsin initially on my healing journey, and that was a big game changer for me. But it was really interesting in my case. It was the thiamine deficiency that was contributing to the low stomach acid levels. And once I started on thiamine, I was able to come off of any digestive enzyme support. Now, this is something that I have written about, and people have given me random hugs at conferences because they found it to be so helpful. I typically recommend the benfotiamine version of thiamine. It's a fat soluble version that has a few more benefits. And I feel like it tends to get into the brain better and support people's energy and brain function. I actually love this product so much. And because I take it, I decided to bring it into the Rootcology line. If you're listening to this, you can get a 20% off by using the code podcast at workology.com when you order benfotiamine from us. And if it doesn't work out for you, you could send it back and we'll give you a full refund, no questions asked. Number 9, L-carnitine. So, L-carnitine is something that is typically recommended for people with actually hyperthyroidism. And I used to think that it was a thyroid blocker. However, studies seem to suggest that it's a mixed antagonist, which in pharmacology, which in human speak, that's pharmacology term, means that it can kind of support thyroid receptors whether you have too much or not enough thyroid hormone. So, in people with Graves' disease and hyperthyroidism, it's used to prevent muscle wasting because it can help really bring up our muscles. And actually, bodybuilders use it for to get like more lean and muscular and to lose weight. I've actually found that it helps us people with thyroid issues with fatigue. In fact, there was a study done in people with thyroid fatigue who were already on levothyroxine. Some of them had thyroidectomies, some of them did not. And 2,000 milligrams of L-carnitine per day seemed to improve their thyroid fatigue. And it was such a big game changer for people. Now, it is something that I have used in my clients where they will say, this is a really, really big game changer for their fatigue and their brain fog and their muscle wasting and their body composition. It helps to transport fats into the mitochondria, the powerhouse of our cells. It is something that I have had as part of my adrenal transformation protocol that I wrote about in my book in 2023 of that same title. And the thing I will say is I actually use L-carnitine, which is meant for like muscles and body. I use that in combination with acetyl L-carnitine, which is more for brain. And the two of them do seem to work in synergy. Interestingly, like a lot of people with hypothyroidism, if they have constipation, if they have low stomach acid, if they have some microbes in their gut that are not friendly, they produce excessive amounts of something known as ammonia, which can be a neurotoxin, and L-carnitine is amazing for clearing that out. It can also help people with constipation. Now, I also have brought this into the Rootcology product line. And if you use the code podcast, you can get 20% off the Rootcology carnitine. Heal your adrenals. Last but not least, adrenal dysfunction goes hand in hand with thyroid dysfunctions. So many times, people who have thyroid issues will get started on thyroid hormones, and then all of a sudden, they'll feel better, and then they crash and they feel worse. This can be because our thyroid hormones and adrenal hormones have an intricate feedback loop. And sometimes, oftentimes, when we have low thyroid hormones, then our cortisol clearance, which is the main adrenal hormone, gets slowed down. And then once we reestablish healthy levels of thyroid hormones, that cortisol clearance unmasks and then it reveals And that cortisol clearance normalizes, which then reveals a low cortisol state. And many times people really, really struggle with this. They have trouble waking up in the morning, they have trouble throughout the day. Some of them just are feeling very tanked as far as their energy, their mood, their sleep. They might be wired and tired at night. They might be reliant on caffeine just to get through the day. They might have trouble with brain fog, word fighting. They might have trouble falling asleep and they might be dependent on things like wine. And I did share this in my adrenal transformation protocol. We focus on gentle, non invasive ways to restore adrenal function using food, sleep, nutrients, and stress resilience strategies over the course of 4 to 6 weeks. And about 89% of people end up with less fatigue and 92% with less brain fog throughout this process. Now, I will say, oftentimes people will say you need to quit caffeine when you have adrenal issues. We don't really take that approach. We actually focus on giving you more energy before we ask that you do something so drastic as quitting caffeine when you're super dependent on it. So, there you have it, 11 overlooked reasons for thyroid fatigue that many practitioners miss. I will be going deeper into all of these reasons this month on the podcast. I've already released an episode with Danielle Hamilton on the blood sugar issue. We're going to be talking to Dr. Alex Carrasco on June 11th about various functional medicine approaches to fatigue. I'm going to be doing a solo episode like this one, going deep dive into adrenals. I'm going to have Elliot Overton talk in great depth about thiamine for fatigue, including using different versions of it. I'm going to be sharing how to create your own T4 to T3. We're also going to get into chronic infections with Dr. Casey Holland, including Epstein-Barr virus, which sometimes can be a reason for fatigue, although it oftentimes comes with friends like mold and parasites that really keep it at bay. And then we're going to get into sleep, because that can be a big driver of fatigue, including sleep apnea. And I also wanted to mention to you that later this month, I'm going to be sharing my new and updated program that's based on my adrenal transformation program, but it's actually going to be focused on fatigue and brain fog. So it's called the Fatigue and Brain Fog Fix. This is going to be coming out later this month. If you would like to join us, for that program, I'll be sharing more information soon. I'll also be putting a link into the show notes. And I hope that this has been helpful on your healing journey. If you enjoyed this podcast and if you enjoyed this information, please be sure to subscribe and leave a review. This really does help us with spreading the word. This is a brand new podcast for me. For many years, I was very resistant to doing my hair and makeup with being a mom of a young one and just focused on writing. And it's been really incredible for me to be able to kind of get my voice back and be able to share my message with you, because I know a lot of times people really do better with conversations like this one. My big hope is that you will find them incredibly healing on your journey. So until next time, this has been Thyroid Pharmacist Healing Conversations, and I'm your host, Dr. Izabella Wentz, PharmD.